1 in 5 Americans struggle with mental illness. Of the highest rates of incarceration, individuals that suffer with mental illnesses are the ones that are most affected. Our objective is to be able to distinguish those with prior mental health problems and finding a better solution to not only decrease the amount of people we incarcerate, but also encourage treatment programs for those that struggle mentally. This chart was specifically created to gain data on the mental personality patterns of offenders with mental illness. Depressive, avoidant, and passive-aggressive are the most common personality disorders among offenders with mental illnesses. Dated back to 1876, the first documentation of mental health was seen in the Colorado Territorial Correctional Facility. The structure of this facility separated those that were seen as criminally insane. Years later, in 1914, a prison physician by the name Hart Goodloe recommended that mental ill inmates be admitted to facilities that would better care and treat them. As years go on, the population of mentally ill inmates grows and makes it harder for prisons and jails to manage since there is a lack of treatment and care, including not enough supervision provided, which leads to problems with increasing rates of suicide and other harm from inmates. The inability to screen offenders with a mental illness at intake is a major problem. Due to the fact that mental ill inmates are not being identified during intake, mentally ill inmates are not receiving the proper classification or being identified. This chart illustrates the percentage of mentally ill inmates in state and federal prisons and jails with any type of mental problem. This also includes a history of a mental health issue and those with symptoms of mental health disorders. This information suggests that a majority of inmates in prison had an existing mental illness prior to their incarceration. Because mental illness isn't being treated during or after incarceration, this leads to many of them returning back to crime and back behind bars. Many relapse, which oftentimes as much as 2/3 of individuals who are diagnosed with a mental illness relapse into their old habits after being allowed to re-enter society after serving their time. Recidivism. Those diagnosed have a 58% rate of reoffending and getting back behind bars for the same crime again and again. Escalation. 12% of individuals are prone to keep escalating their crimes further and further after each time they get a chance to re-enter society. Entering society again. Those who get the opportunity to be given the clear to re-enter society often have conditions to remain to the outside, such as absence from substances or court-appointed therapy or treatment which must be completed. Barriers. The most common barrier reported when it came to entering society was finding out where to begin again. Oftentimes, these ex-inmates are left living with friends or relatives that are willing to take them in. A lot of inmates feel optionless due to criminal history playing a large role in job opportunities, which leaves them unemployed, and when they get desperate, tend to turn back to crime. Data on recidivism rates of mentally ill offenders illustrates that mentally ill individuals are more likely to return to jail at a higher rate than those who are not diagnosed with a mental illness. The increased rate on the graph illustrates a higher increase in recidivism among non-qualifying offenders. Non-qualifying represents a non-serious crime and not their mental health status. This increases in recidivism among non-qualifying offenders shows that the mental ill return to jail for petty crime that is catalyzed by their illness. Of all the possible treatments, an individual who is willing to be better will make the most progress when working with professional therapists and make changes to their life. Medication for certain medical conditions such as mood stabilizing drugs make large differences in behavior. Having a daily routine or structure helps when it comes to improving familiarity and comfort, since you will always know what's next, and routine is often used as a form of therapy. In prison, having a balance between authority and the inmates is crucial to the living environment for both inmates and staff. Socializing with others will help establish relationships that can make a living in prison environment less isolating, which helps morale. Oftentimes, those who suffer from severe mental illnesses in prisons find themselves in trouble. Being able to contain the individual and getting them out of the general population is a great way to contain the situation temporarily. If an inmate is under the influence of any drug before entering prison, having a way to get them into rehabilitations will be the best way to help the individual. It is important that we bring awareness to help those that suffer with mental illnesses and promote better alternatives than to quickly resort in sending them behind bars and then thus creating a better society for everyone.